Good morning. It's Friday morning, January 10th, and I know you have a number of videos that were from the 16-week Sociology of Health course last fall, but I thought it would be a good idea to do a video every week, kind of update those videos, and so this is the first one, kind of an introductory video. They'll be shorter, these videos, for the most part, since they're updates, so please stay with the videos YouTube videos that I sent you, the list I sent you earlier. I think it was before Christmas break even, maybe. So, welcome to Sociology of Health. This is Fast Track A 2014, and I look forward to working with you over the next 8 weeks. The work will be compressed. It's 16 weeks. We can do it in 16 weeks, but we can do it in 8 weeks. I say we, there are 4 of us, 3 students and me. And so we'll be doing this journey together over the next 8 weeks. What I'd like to do in this video, talk a moment about the theme of the course. We'll just briefly go through the syllabus, which you now have. Talk about the new Blackboard organization, which hopefully you've had a chance to go up and take a look at. And just highlight the 2 or 3 notes that I've already posted, even the notes that I posted for next week on the first segment, the demographic background, and I even have a discussion thread out there. And then I will send later this morning an email that contains 3 YouTube videos from Michael Marmot. I went to the American Public Health Association meeting in Boston in November, primarily to be able to go to that portion of the conference where Michael Marmot came and gave the, the keynote speech. It was captured by someone into 3 videos in sequence 1, 2, and 3, and I'll send those to you. I think you'll find him a dynamic speaker, an impassioned speaker, about the issue of social contextual influences on health and the opportunity of adjusting social context in order to improve health. You'll find him an impassioned speaker, and it'll be fun to listen to him because you're doing a lot of readings, including he is the co-author of our textbook. Pay attention to this, read these chapters. You'll find that some of those videos that you have, I probably won't go back to this, but some of those videos that you have address chapters in this book. Okay. The theme of the course, as you probably know by now, is the contextual influence on population-level health. We're in a population model as opposed to the traditional and still viable and will be forever, the medical model, which is more individual-focused. That is the diagnosis that you encounter when you go into the physician, and is the context for the care and the treatment that's provided by nurses and all of that are in the healthcare, acute kind of care, I guess you'd say. I'm not that familiar with all of the terminology in healthcare other than the sociological community health kind of perspective. But anyway, this complements, a population health complements a medical model individual level. It provides a population context for what is expressed at the individual level. And it also, in this course, we emphasize the context in terms of the environment, the physical environment and the social environmental context of individuals and the populations that occupy those contexts and how that can relate to individual level health. Another way of thinking about this, and you'll see this as we go in some of the videos that we've done, and I'll speak to it again, I'm sure, in another week or 2 in a video, is what we call the Upstream Downstream. There is a one-image document, and you'll find it also in the couple of PowerPoints that are up on that up in the introductory section of Blackboard that have to do with the equation of, on the far right-hand side is context, in the middle are behaviors, and in the outside, or on the far left-hand side, are the health outcomes. The idea being here is that when we want to understand population-level health outcomes, which is what the demographic background is about, how to express health outcomes in terms of information off vital data, say, for example, birth outcomes, well, not death outcomes, but causes of death. As we go upstream to behaviors that might have led to those birth and causes of death, and then go farther upstream to context. So in such a way that if we are at the, that would be if we're at the health profile, health outcomes, and we look upstream at behaviors, then we can see the behaviors that are beginning to give rise to or explain why these, for the most part, why that profile looks the way it does. And we go farther upstream to the context that give rise to the behaviors that give rise to the outcome. And if we're in the context, we can predict outcomes. If we're in the behaviors, if we're in the outcomes, we can predict behaviors and contextual dynamics. That's what the course is all about, upstream, downstream. And if you look at that medical college admissions test, which will eventually, I'm sure, will be in nursing admission and pharmacy admission and dental school admission and all of that, where they're emphasizing sociological perspectives and social sciences generally perspective, it is that same upstream downstream kind of phenomenon, so that when the physician or the nurse has in front of her or him a patient, not only do they see the physiology in that person, but they are begin to get an awareness and maybe questions to ask about the behaviors that are upstream, and become more aware of the context of that individual, even farther upstream, that may have given rise to the behaviors that gave rise to the illness that bring that person in front of you for treatment. So this whole upstream downstream has become very prominent. And I think I have in one place there, I'm not sure, and I'll double check, there is an interesting link on upstream downstream doctors. And it has its carryover, of course, into upstream downstream nursing. So if I don't already have that link out there, I do have it out somewhere else. I'll post it on the website or send it to you or something. Okay, so that's the theme. The syllabus, I hope you've had a chance to take a look at that. Kind of talks about what we've already talked about just now. That medical college admission test, changes in rationale, is the first link in that course overview. Do take a look at that, WHO World Health Organization, kind of a summary monograph of the text. In fact, the authors of that World Health Organization monograph are the same in our text. The text is a more elaborated perspective, so it's a nice summary presentation. The other one there, as you're going to find as a link up front to begin looking at, is echometrics. And you already have an intro video out there, as well as an echometrics video that you can use to kind of help you explore what that echometrics document is all about. And there are some notes now posted on the echometrics in the additional Sampson article. Those are already posted now. I posted those the other day with an announcement. You may have already seen them. Echometrics is a way of measuring the ecological effects, the social contextual effects. We're kind of thinking as social ecologists in this class. What is the ecology of context that influences behavior, that gives rise to good health or bad health, that sort of thing. So take a look at that echometrics article. It's a dense article and it's got a lot of statistics in it. Don't worry about the statistical equations. We'll make references to them once in a while, but the key equation is y equals xi plus wi plus zi. Y is the outcome variable of interest to us. The xi are the individual level features that give rise to that. The wi, like education, age, gender, and that sort of thing. The wi is group level effects. Could be class differences, as in socioeconomic class. Could be racial and ethnic differences. Could be family differences. And then the zi is particularly interesting to us, and that's the contextual, be it temporal or physical, social, contextual, neighborhood kinds of things, let's say, that might influence people's behaviors that give rise to those health outcomes. And you'll see that equation expressed throughout those PowerPoints and as we go through the course. And next week as we do those, that segment 1 demographic, mining for gold is looking for the ZI explanation in those articles about those health outcomes excuse me, that are described in that set of readings. And that's the mining for gold. And there's a video on that as well as some notes, and they're already posted. And you already have the older video from last year, or fall. Just briefly about the program level outcomes, I want to address number one, developing a sociological, social scientific imagination. Here in sociology and social sciences in general, the idea is, particularly in sociology, which makes it interesting for the medical college admission test changes and the rationale for it, are the contextual influences on human behavior. And of course in our course the theme is about behavior related to or leading to health outcomes. So instead of thinking individually, as this outcome calls you to do, think about population. I mean, you can frame it in your own mind when you think about how your own individual narrative, who you are at this moment and who have you become, to what extent has that becoming of who you are influenced by all the context you've passed through in your lifetime. Family context, school context, friend context, context of 9/11, all the kinds of contexts that we have gone through in our lives that bring us to this moment that gives the expression of who we are. So when we're thinking about this, we can see how that would work in terms of evolving our own becoming narrative, shall we say. But we want to think about it in terms of population, expand it out to population base. As we look at populations in a neighborhood or in a county or in a country or a metropolitan area, how are those populations influenced in their own narrative through time by the context that they pass through, the transformations of the neighborhood, the transformations of the city, transformations of the county over the years. You can think about the Depression, you can think about all kinds of things that have been going on over the last 50 years that change the dynamics of urban areas and rural areas, and how those populations might be influenced that. So that's kind of where we're on to or thinking about in that program level SLO. And we'll come back to the others as we get through it, the course. Draw your attention to the written assignments. I think I posted the first one already. If I haven't, I'll post it on Monday. The first assignment will cover segment 1, which is this next week, takes us through the 17th. The way the written assignments work, not due until the week following the segment that they cover. That allows us to go all the way through your getting the readings done and any discussion that we do up through the 17th, and then the next week you can use whatever time you need to write the assignment for segment 1. So you'll have a week following. Now, while I'm speaking of the discussion, which is part of the syllabus here, there are only 4 of us. I count myself in this, just like you. Get into the discussion. The discussion I think has been very useful, informative, exploratory in a number of things in the expanded class, 16-week course, and even we did a fast track B for a couple of students in nursing this past fall, or 2 or 3, and they had some pretty good discussion going, even the 3 of us. So get in the discussion, share your ideas, bounce things around, say what does it mean by this, and then I get in this and say, well, this is what I think it means. So get in the discussion. I think you'll find it really good, an evolutionary way of developing your own perspective. Many of you, I'm sure, I say many of you, are only 3, coming out of a medical model training, very likely. 10 years from now, counterparts will have a very contextual training by the time they come out. They will be population-based. So you're very much likely to be in the medical model. So this course will create an opportunity for you to think maybe a little differently that will complement the uniqueness of your medical model, which is absolutely essential to the carrying out of tasks as nurses, but provide that upstream context framework to So get in the discussion, talk about that kind of going upstream, if you will. And I'll enjoy getting that discussion with you. So get into it. In your written assignments, pay attention to those. You'll see how I've got them laid out. The first will probably knock it out, but if you don't, you'll post it, I'll give you comments, put it back. I can put it out there, we'll comment on it, try again. But you'll find over the course of the 8 weeks that we have, your ability to navigate the contextual issues that we'll be talking about will become easier and easier and easier as time goes by.
I also want to point out, as I was coming on down here a little way, you'll see in the participation and discussion I've got a rubric. So it's 10% of the grade, and so just get into it, I guess, and you can take it that rubric. The comprehensive essay is something we'll work towards the end of the semester. We build it in a way, argument as we do reads, because what it will be an essay that you'll think of a particular health outcome and then explore it, explain it in terms of the contextual dynamics, and you see how that works as we go semester. So, and your references will come from the readings that we have already assigned. There's quite a good set of readings that will help you build that contextual argument. Okay, so, and then you can see the course outline and what we're going to be doing in segment 1, segment 2, segment 3, segment 4, and that thing. So that's all pretty clear, I hope. Of course, if anything's not there, when you're in the discussion, raise it. Raise the issue in discussion. I'm not clear about this one particular point in the syllabus, and then we'll deal with it in discussion. That way everybody can see it. If you want to ask me a more individual level question, email me or call my office. I use a cell phone. Call my office. I'm available from 5 in the morning until 9 o'clock at night, 7 days a week. So if you call my office number or email me, I will respond to you. Absolutely guaranteed. I can't say absolutely because who knows what might happen. But 99 times out of 100, I'll respond to you within 2 hours, guaranteed. So if you want to ask me a question individually, but it's good to put all those things out there. Every question is a good question. Put it in discussion. We can all see it, and we can work around work the answers out together. Now I said there are 3 notes already posted. One is the course introduction notes. You'll find those out there, much like what we were just talking about. And in there is an expression of that equation in some elaborated form, y equals xi plus wi plus zi. The second Prof's Notes 2 is more about the econometrics article and the Sampson, basically that article. And I kind of walk you through with some highlights of things that I see in there that are kind of interesting. And close with the y equals xi plus wi zi again. And then the third set of notes are about the social ecology of health PowerPoint that you'll see up there. I'll kind of walk you some issues there. We're really social ecologists is a good way to think about it. We think ecological niches, if you will. And how those niches influence the populations that occupy them, and how the niches are influenced by the populations that occupy them. So read through those 3 notes, and like I said earlier in the video, there are already the notes, first set of notes. I think there's actually 2 sets of notes I've already put out for next week. I have to post these early. One is just a summary of the articles for the demographic segment. And another one is about a quote by Alvin Tarloff and Bruner, which I think everybody has found that Bruner article interesting because it is about the physiology of stress. How is it when we say, one of the ways that we can think about this is if a neighborhood is cohesive, stress is low. There's good interpersonal interaction, good associational behavior, good levels of trust, and all that. So your stress levels are low, and so that means your autoimmune system is doing pretty well, which means your health outcomes are pretty good, for the most part. But if you're in a neighborhood that's stressful, not good interpersonal reactions, the kind of neighborhood that after dark when you walk, the hair on the back of your neck kind of rises, you get these adrenaline rushes, small adrenaline rushes. Well, as we'll know as we go through this course, our society nowadays is so complex, there's always a level of adrenaline rush going on anyway that erodes our autoimmune system, which we think in the work that we all do, and you too, gives rise to higher susceptibility to disease, illness, and that sort of thing. But anyway, where the social cohesion is low, stress is high, the autoimmune system becomes impaired as a result of that stress, and the health outcomes are not so good. The Bruner article deals with the physiological relationship to stress, and I think you'll find that article interesting when you get to it next week
And so that one that one note deals specifically with Bruner and the way Alvin Tarlov, who's I describe him in there, a major player in the social determinant way of looking at things, relates all of that, puts it all together. I think you'll find that article particularly interesting. So that's all I have to say for today. I look forward to working with you, and I'm going to upload this video now to YouTube. It usually takes an hour or two to get it all processed and whatever goes on. And as soon as they send it to me, then I'll forward it to you. In the meantime, I'll forward to you those 3 videos by email link. I think I've not done that. I'll check. By email link, I'll send those to you within the hour, and you can take a look at the Michael Marmoth YouTube videos. So anyway, take a look at Blackboard, and let's get into the class. What do you say? And I'll do a video sometime midweek next week. You have a good weekend and take care.